Good morning, everyone. Welcome to the MOTS EDI webinar, May 5th, Cinco de Mayo. Welcome, and for those of you new, you have a tiny menu popped up when you joined, and it has some boxes and some buttons and stuff, and one of them is a question box, and if you have any questions, issues, something's not clear, or something else pops up in your head, you just type it in there, and hopefully one of myself or one of my coworkers can help you answer the question. And if one of those questions might be interesting to know for everybody else, then we might bring it to the floor of the webinar. The webinar is recorded and will be posted on our website. And it usually takes a day or two. It goes pretty quick these days. So if you won't be able to make it or something comes up and you figured, oh, well, I'd like to share the webinar with some of your coworkers or other people within your organization, then you can just go to our website and find the webinar there and check out the pieces that you might have missed or you think might be interesting or nice to know for other people within your organization. So, okay, that's a little housekeeping, and I'd like to start with the welcome. Why do we do these webinars? Well, of course, give you information on changes. And currently in MOTS, there are no changes and no enhancement. There's no real programming going on. There's a lot of other stuff going on in our organization and with other systems, but MOTS is nice, safe, stable, and going well. So are there any data issues to discuss? Because sometimes the federal government makes changes, and because of those, we are sometimes required to make changes on our end, but there's nothing at the moment. So, and there's nothing currently happening that is getting everybody's attention. If you have any feedback, if you have any questions, if you have any suggestions, please let us know. That's why we have these webinars as well. And if one of those ideas that might be interesting, that we might make it an item on our agenda for one of our future webinars. So, and again, hopefully we can answer all the questions that you might have today. And if not, then we'll definitely find someone within our organization and see if we can answer that question later. Okay, and then I will pass the microphone and I will give it to Lyle, and he's going to talk about the current state of affairs. There we go.
Good morning, everyone. Thanks, Pete. So currently the MOTS team, we're still working from home. We've pretty much got this all down now with our state-issued cell phones, and we've been able to reach out to all you providers as needed. We still are under guidance not to approach providers, let you approach us while we're all busy during these hectic times with COVID going on. And we know we're also in a mental health crisis, so instead of reaching out to you, we wait for you to come to us, and then we respond to you as fast as possible. If you have any issues, email MOTS support, and we'll help you as fast as we can. Just asking you to be patient with us, and we've canceled all in-person training. And so if you need a training, just reach out to MOTS support, and we'll be happy to give you a one-on-one. And in these new times, we've noticed that phishing attempts have been up, which is where someone will send you an email that looks like it's from MOTS support or look like it's from one of our team members, but if you look closely, something will be slightly off. So just be aware of phishing attempts. And that's our current state of affairs.
Thank you, Lyle. Yes, we will never send you an invoice or anything like that. If anything about finances or money or requesting something, we would never do that. So thanks, Lyle. And then we go to report changes. There are some report changes coming up. Go ahead, Justin.
Thanks, Pete. So just to let everybody know, our database administrators have decided to replace our current reporting tool, SAP Business Objects, with SSRS Report Builder. I am in the process of converting the reports from the one to the other. Now, most of your standard reports, like the active client list, are already running on SSRS, so they won't be affected. Others, like the performance reports, are going to look different after the conversion, and the same is true for any custom reports that you may have requested. This isn't as smooth a transition as we would like it to be, So I just need to make you aware of the possibility of delays. I can't guarantee that I'll get everything converted by the time the current reporting tool is shut down, which will happen sometime this summer, but I am working on it. I have cataloged all of the reports, and I'll get all of them up and running just as soon as I can. In the meantime, if you need data out of MOTS, please send a request to MOTS support so I can either put together a query for you or point you to the health analytics request form for the more complex reporting needs. And just to reassure everybody, your regular data submissions and response files will not be affected by this at all.
Excellent. Thank you, Justin. Yes, just reports. And the performance and dashboard are very complex reports that took, well, months to years, I think, to actually develop to get the right one there. So just to switch that over to a different system is not going to be that easy. So please be patient with us, but we'll get there. Thanks, Justin. Okay, and then we have a new MOTS URL for the MOTS CE app. Go ahead, Lyle.
So MOTS is going to be getting a new URL address. Just to let you all know, this is not the new MOTS. This is just some behind-the-scenes upgrades we're doing with Cold Fusion. And these Cold Fusion updates will require a new URL for MOTS. So in the next couple of months, we'll be asking you to change your bookmarks and update them. And we'll be sending out the whole timeline in the MOTS Messenger, and we'll continue to give you updates on this new URL during these webinars. The old MOTS will redirect to the new MOTS URL for an easy transition. So when we make the update, when you click on MOTS, it'll just kind of send you to a new, from the old URL to the new URL. And then the best way is for you to just update your bookmark from the old MOTS to the new one. And again, this isn't a new MOTS system. It's just some behind the scenes upgrades to our current MOTS, just some Cold Fusion updates, and it requires a new URL. So we'll make it as easy as possible. And if you have any questions when the timeline comes out or anything else, you can email MOTS support, and we'll be happy to give you more information as we get it.
Thank you, Lyle. And in regards of this Cold Fusion update, we had an issue already for people trying to connect, and all it took was just to clear your browser history once, close the browser down, bring it back up, and then they got it working. So there was some weird system JSON error or something that people ran into. So just an FYI in case you happen to run into it or hear about it or something like that.
Yeah. And Pete,
thanks, Lyle.
Could I add real quick?
Sure.
Pete? And we also, for those of you that log into the MOTS web portal and kind of pre-scrub your files with there's a little online tool there to do that. That did have an impact on Monday for a short time period, but it should be fixed. We had a provider verify with us that they were doing fine with it. So if you have any issues with that, let us know. Send it to MOTS support or myself. And also, this will not be impacting anything to do with the secure file transfer site where you send your files back and forth. This is just for the MOTS web portal. So, thanks, Pete. That's all I wanted to add.
Excellent. Thank you, Jody. Yes, always important to be clear. Okay, and then our wonderful P number form. Go ahead, Mary.
Okay, thanks, Pete. So we've updated our form for requesting P numbers, either for new users or if you're disabled and you have to re-enable your P number. This is the form, the new form that we are using, and it's we made it so that you can fill it in on using Word. And you notice around the bottom of the form there is the program and user rollers. So we updated this form because we not only have P numbers for MOTS, but there's other database systems that we are using. And so if you click on MOTS and then where it says choose access level, if you hover there, there will be a drop-down menu that will appear, and then you can select what kind of user role the person should have. Should they have admin rights, write or read only, and or should they be taken off of mods? So this is just our new form, and if you need it, you can request for us to send it to you. And that's all I have.
Great. Thank you, Mary. Okay.
There was a quick question about P numbers.
Sure.
It asked if our P number expirations still suspended.
Yes,
you
they
mean
are.
the passwords?
When you log into mods, it still says negative 18,000 something days until your password expires.
Oh, that might be
what
it.
they're talking about. Yeah.
Okay.
And the same for my OR number. I haven't changed it since last year, so I think there was one time, and that's it. I still have the same one, which is very unusual because normally they want you to update it was 3 months, and then they went to 60 days, but now because of this whole pandemic and working from home, they kind of suspended it for a while, but we'll see when it comes back.
I can add that if anybody has a question, if their P number is still working, they can ask us, send us an email, and we can check for them if they need to contact the help desk or fill out a form.
Thank you, Mary. Okay, one of the issues that sometimes pops up is that we have different places and that we have logins with passwords and with user IDs and passwords, and then there's secure email that has user ID and password, and it's very easy to mix them all up or kind of use the wrong one at the wrong place. But we have one thing that's always different is that a secure email coming from mod support and or the DRM SQL admin, the username is always the recipient's email address. So that's a big difference from the P number that we have for the mods client entry web portal, because where we always have the P number as the user ID. The one for the SFTP server is a completely different one that is created in cooperation with Jody. She helps you set up a user ID, and she helps to set you up folders inside the SFTP server where you can kind of drop your stuff and find your stuff. And that's the third one. So it is possible that you have 1, 2, or maybe all 3 of them, the different types of usernames. So please be mindful and careful that when you go to a certain place to make sure that you pick the wrong one, because it's very easily, there are so many passwords these days, and this is just us for a couple, and I'm pretty sure that everybody else in the rest of your business and private life have a whole slew of IDs and passwords and stuff like that. So one very important tip, it should never contain your user ID. So if you have a P number as a user ID, then don't use that as in your password. So it might fit because it has a letter and numbers and stuff. So although I think we need a special character these days, so it might not work anymore, but be careful because some of them might let you. So please don't repeat that in there. I thought we'd bring that up because it's been a while since we talked about that. Sometimes we struggle with all the different systems that you guys might have for security, and then we get a secure email, and if we sometimes mix them up. And one of the tips that I got from Jody the other day says, well, if it sounds urgent and I can't figure it out, I'll just send a secure email from us, from the state. And then all you need to do is just reply, and then we have the stuff going. So I thought that was an excellent tip from Jody, in case something like that happens. Okay, the next one is Justin again, names in MOTS.
Yeah, thank you. Well, every once in a while, we like to remind users of the importance of the name fields in MOTS. Accuracy is a big deal in these fields because they help us identify individuals across systems. So when we run our statistical reports, we're not counting the same person several times over. This month, I'd like to mention the last name at birth field again. The purpose of this field is to match individuals whose last name may have changed by tracking their last name at the time of their birth. According to the MOTS documentation, specifically page 21 of the MOTS reference manual, which you can see here, if you don't know what their last name was at birth, you should enter their current last name. Now, MOTS has rules that block the entry of some invalid entries, such as unknown. But recently, we've had an increase in instances of misspellings of unknown being submitted in the last name at birth field. And we don't know if this is a mistake or a deliberate attempt to force these entries in, but either way, it causes problems. Two of the tables that you see on the slide show an example of what happens. If I was a client, and if someone entered me into MOTS as displayed on the screen here, first name Justin, middle initial D, last name King, and last name at birth as a misspelling of unknown, an alias would be created. And state records would show that my name is currently Justin D. King, but sometime in the past, I went by Justin D. Ucknown. These false aliases create clutter in the database, and they significantly increase the difficulty of identifying duplicate client records. I've also prepared a short list of some other common last name at birth entries that are problematic for us, such as not provided, not entered, refused. We've seen the person's first name repeated in the last name at birth field or their full name. We've seen nicknames. We occasionally see the name of the clinician assigned to work with the person. I check for over 30 different misspellings of unknown. We've got single letters or non-letter characters like hyphens, some multiple names separated by or AKA, and quite a bit more. So the request is, please don't do that. If a client's last name at the time of his or her birth is not known or has not changed, please just enter the current last name.
Excellent, thank you, Justin. There we go. I think I jumped straight into the next item that is for Jody. And back to the agenda wasn't working properly. Sorry about that. So I'm jumping straight to the next one, like who to report in MOTS, page 1, because we have 4, and it is Jody to present these. Go ahead, Jody. Sorry about that.
All right. No worries. I was like, hey, whoop, there it is. So yes, good morning, everyone. So we know there's a lot of new organizations that have come on to reporting to EDI, and there's also brand new organizations to MOTS and new staff. And so we thought we would just cover this again. We had gone through a work session with one of the providers, and we actually were able to kind of really drill down onto which clients should be sent to MOTS and which clients shouldn't for different reasons. So this one we have here is your status files. So for programs that your organization has, clients that are in DOE, methadone, block grant dollars, county contracted dollars, or if you subcontract with a county for services on their behalf, you're utilizing that types of monies, direct state contracted dollars, so even non-OHP Medicaid, but there's somehow another state funding source, the substance use disorder element 66 and DOE element 65, and of course all OHP Medicaid clients with services, well actually all OHP Medicaid clients need to come into the MOTS status files. And when I talk about status files, we're talking about the files that actually have the clients, as Justin was talking about, last name at birth, their date of birth, their marital status, their legal status, any addictions. It's really a lot of their demographics, their behavioral health and substance use type of data elements that we collect. So Pete, if you could hop to the next one. Okay, and also clients that need to be included would be a client whose insurance copay is covered with public dollars. So maybe they have insurance, but your organization offers it where the copay is covered with some sort of monies that are public. Indigent funding programs, the Oregon Youth Authority. A lot of you have what's called a sliding scale fee client. Those should be reported. Crime victims assistance, that type of program should be reported. Offense specific, the Department of Human Services direct program, and DMAP should also be included. So these are going to be your status files. So the status files kind of get sent for everybody that you provide services to, with the exception of some completely funded private pay clients if they're not under a DUI program or receiving methadone treatment. So this is the status piece that you send in, because most of you are probably familiar, you got a couple files. If you submit your files manually, and if your system is automated, then your system is generating these files and sending them to us. So this is the status, and we're going to talk next quickly about the service files, and we call them non-Medicaid service files, because the services that are sent to MOTS are only ones that are not sent to the Oregon Health Plan through a CCO or to Medicaid for Oregon. Now, the reason we don't have you send those is because you already sent them, and our teams have access to those data repositories to get that information. So we don't need you to send it twice. So what we do have you send is anything that is outside of OHP or Medicaid that would be considered a non-Medicaid service but is paid through public dollars. Or we have a couple special programs, like I mentioned, DUI and methadone services. All clients are reported for their services, even if they're private pay, 100% private pay, because there are some statutes and rules that say those clients have to be reported to the state and to some of the federal programs. So what I wanted to we'll cover here, so DUI and methadone, kind of regardless of who pays for them, unless it was OHP or Medicaid, they come in your service file. Block grant dollars, again, county, a lot of these are similar to the other list, like the county contract dollars, direct state contracted dollars, as service use disorder element 66 and DUI element 65. Of course, OHP clients with services not covered by OHP but are covered with public dollars. If we could roll to the next one, Pete. All right. Then again, client insurance copays that are covered with public dollars, indigent funding, Oregon Youth Authority, any sliding scale fee clients where part of their costs are covered by public dollars come in, crime victims assistance, and offense specific. So one of the questions we get is, what exactly does 100% private pay mean? And this is typically a service that is paid entirely by private insurance or self-pay. And, so those type of clients normally don't come to us. So if, somebody comes to your organization for mental health services, they have Blue Shield, Blue Cross, they don't have any public dollars, they're being seen for things that are not DUI or methadone, you don't send them to us in the Medicaid service file, non-Medicaid service file, and you also do not send them in the status file. Now, again, the exception to that is going to be the DUI and the methadone, like we talked about. Those have to be reported to us regardless of payer type. So, there's been some conversations with some of the different providers and that they wanted to make sure that they aren't sending their 100% private pay clients to us. So, this is we've gone over is kind of the minimum requirements for you to send data to us. It's a lot. I know there was 4 slides. We went through them a little bit quick, but for those that do go back and look at the recording or you share this with other folks in your organization, they'll have all these listed, even though they kind of look duplicated. So that if there are questions after this, or we'd like to talk about it in further detail, you can reach out to Mott Support and myself, and we'll set up a time to go ahead and do that with you. I think that's it, Pete, unless I generated a bunch of questions.
I see somebody raising their hand, but I don't really see a question. So let me take a quick look at the attendees, see who that is. I have two, Sasha and Anna Maria are raising their hands. So there is some issue. Please just type in the question so we know what it is.
Okay, one question we did get is, and this is a good point, so for that this is, if the client has Oregon Health Plan Medicaid as their secondary insurance, the question was, we still report in MOTS? Yes, and yes, you do. So even if OHP Medicaid or the CCO is in a second position, not the primary, you would still report them, because there is the potential that they will have services covered in some part or portion by the OHP Medicaid services.
Great. I think I saw another question pop up.
Yes, it says, the question I have is about sliding scale fee. If a person is cash paying sliding scale fee, they get reported. And what I'm thinking there is that on the sliding scale fee, they do pay cash for part of it based on where they land within that scale. And then other dollars are typically used to offset that differential based on the sliding scale fee amount. So with that being said, if they pay cash for their portion, but the remainder of your services is somehow reimbursed or written off or something against public dollars, then yes, they would need to be reported.
Right, yeah, because a lot of times that's general funds or something else that the organization has set up to deal with that. They compensate to complete the total fee. Yeah. Okay,
and another, Anna said their sliding scale fee at their agency is not subsidized by anyone. This payment is considered a private pay. So if your organization is, say, a not-for-profit and you have private funding that comes in that's not considered public dollars, then that would kind of be your organization's decision on how your sliding scale fee is set up. But if your organization uses any type of funds that are public dollars, then it would need to be included. And if you want more, we have some business analysts and some folks on our team. I'm kind of a technical person. So Pete, maybe you could add to this, or maybe, I think I answered that correctly.
I think you did. Yeah, it is, because like you said, it is a sliding scale fee. So it's not the complete amount that the service requires. So there's some part of the money that comes from somewhere else. And within most of the organization, there are different funding streams coming in. A lot of them are public funding streams, or contracts with counties or CCOs or stuff like that, or with the state directly, or federal grants, or any of those options. And because like you said, the scale, somebody lands on a scale, which means that they're paying a part of the total amount required, or the total cost. I'm not saying required, but the total cost of the services provided. So there's other sources where they come from. So unless you can define every piece of the money not being public, all private, and it is not a Dewey and it's not a synthetic opiate, then it might be. But it's very unusual from our experience within the state of Oregon. A lot of our organizations have some public funds coming in somewhere, and usually end up as an organization in general fund or stuff like that. So, and like Jody said, if they're still not sure, maybe we can set up a meeting with you and somebody from your billing department, find out how the finances work within your organization, and we can pinpoint it a little better, because it differs per organization. There's so many different options these days that we can do that as well. We're willing to participate and help you pinpoint it to exactly how we'd like to deal with that, or how you should deal with that. I hope that answers the question a bit.
We have one other question. I think this would be relevant to everybody. So if you accidentally send a completely private pay client to us and you need to correct that, there's kind of two ways you can do it. There is a feature that is through the web portal. If you've gone through the training and have been granted access, you can delete that client. Some organizations do this, but a lot of them will choose option B, which is you can send a request to MOT support for a data correction, and one of our team members can delete that for you. So for your organization, sometimes if you go through us, you know, if there's other questions, like maybe this client was public funded and then they became privately funded, you know, you may not want to just totally delete them, but if they have never been on public funds and they got sent and you want to delete them, then either A, contact us on how to go through the portal to do it, or just send us a data corrections request to MOT support and our teams can assist you with it.
Right. And if they have been first public and then go fully private, we still need that information, because they part of the treatment episode, and that's what we are collecting. We're collecting in the status, we're collecting episodal data. We have an admission date to start, and then there's a discharge or an end of the treatment episode. So if any part of that is any public fund, even if it changes over time, which happens because they get insurance or they find work, and so many things happen in people's lives. But because part of it was already in the system, we need the information to complete the picture of the treatment episode of the individual.
Yep, and I know a lot of folks are super familiar with doing the deletes, and I do appreciate the question, but kind of just going through it so that for those that may not be familiar with it, we can kind of help answer some of those questions. Because when you do delete the client, so if you choose like, oh, I sent one, I need to delete it, when we delete it or you delete it, it deletes everything out of MOTS for that client that was ever submitted. So as Pete mentioned, if your organization had done some public fund, they were publicly funded and then they came back and they're privately, and then you want to delete that, we can't really delete just that one private funded, but we can give you some guidance on how to use an appropriate closure reason and things like that. So just contact us if you're unsure, and we'll be happy to help you.
Excellent. Thank you, Jody. Okay, then we can skip this one. We just did that. And we go to accidental closures, different story. Not accidental, sending the wrong one, but one of the questions that keeps popping up. So we have a client and they were inactive and a discharge status of left against professional advice, as an example. But that was the wrong one, because the individual actually completed, and we need to add a due completion date. What do we do? Because we know that if it's left against professional advice and just changes into completed, that is possible, but you can't make any changes to any of the data in the treatment episode of any of the screens that are out there. The treatment status, in the inactive treatment status, can be changed, because it can be kind of requested to stop the program, and or they were what are the other ones? They went to jail, they were deceased. There's a whole bunch of inactive statuses, but you can't change anything else. So what do you do when you realize that you accidentally changed the wrong one and closed the wrong one. The best way to deal with this situation is just create a new treatment episode. And then the admission date you have to pick. You can't pick the same admission date because the system will kick that out. It says, sorry, that's already in the system. So that's, it won't accept that. So you get an error. So what we always recommend is take an admission date the day after the incorrectly closed admission date. And once that is in, and then you submit that one, and you complete all the other necessary fields that you have, and you have all the data already in your system, so it should be able to extract a new record for that individual with the new treatment admission date. And then you submit that, and then you have an active client, and then you can make any of the changes you want. You can add that due completion date, if they changed for work, for legal status, whatever the changes were that you were about to make, but you realized that you accidentally already had it closed. So best way to deal with that is, because there's no other way to update any of that other stuff. So create a new one with the admission date the day after the incorrectly closed admission date. So we thought we'd bring that up because we had that question quite a few times here and there, and it's one of those things that keeps popping up. Okay, and then we go back to the next item, and that's item number 10 already, switching systems. Or is there a question I need to throw in first? Anything that popped up? Just checking.
We have two. We have one from Anna, one from Tom. Anna asks, what impact is there on people who do not have a legal status and are actively trying not to become a public charge if they get reported on MOTS as using public funds? And if I understand that correctly, the question is regarding their kind of like their criminal record. If that's what you're asking, Anna, we don't report anything to law enforcement. I don't know, Pete, if you want to elaborate on that.
No, that's
or maybe
just
let me know if I'm misinterpreting the question.
No, I think you're answering it correctly. That's how I would read it. So.
All right, and then Tom asks, when did crime victim assistance get added for reporting?
Oh, that's a good question. I would not know.
I think that we identified that when we worked with one of the providers, because some of the funding streams for that program were public dollars. Am I on mute?
No. We're just waiting. I'm kind of
Okay.
leaving it hanging because I want to see if somebody replies with another question based on that. So in other words, we don't know how long it's been out there and or when that was introduced, but we've had these questions off and on, and we had one of our business analysts, Mark Jansen, who regularly hangs out with us on these webinars, but I haven't seen him today yet. But he did a pretty thorough research and came up with all the listings that Jody gave you, that all these programs, we found out, we talked to the program people within our organization, and that was the extensive list that we came up with. So, and if you haven't reported them in the past, then don't worry about it too much. It just from now on forward, if you realize that there's a few more people that need to be reported, please add them to your files.
So it looks like there's some additional information on that question of who do we report this data to? And it looks like Anna added that it's not criminal, but citizenship status. And then another individual asked, do law enforcement agencies have access to MOTS? So I think we have two pieces there. Right. The law enforcement does not. The only thing that we do share is just some of the commitment reportings, like if somebody was committed. Right,
Correct.
Pete?
Correct.
Right. They don't have access to MOTS. We can get a little bit of data out of MOTS for them upon request, but it has to be a very specific request, and it's usually limited only to civil commitments and occasionally DUII, but that usually goes more to the DMV to verify that they have completed a program rather than any sort of criminal charges.
Correct.
And I'm not aware that
the
we do
requests
any.
go through us. They don't look at it themselves.
No. Correct. And we don't report on like citizenship status. I don't know that we even have that as an option on our. We have race and ethnicity and some of those things, but we don't have an actual data field that talks about citizenship. So.
We do not.
Right.
Great. Thank you, guys. Okay. Why don't I give Jody the microphone, and in the meantime, we'll keep an eye on any other questions popping up. Go ahead, Jody.
Okay. So many of you have heard this, probably can rehearse it in your sleep, but surprisingly, even with COVID and different things going on, we still see businesses continuing to move forward, and different organizations are switching systems, or they're upgrading to the latest platform of their current system, or maybe you've been entering manually and now into the web portal, and now your organization either has the ability through your system to send to us, or you get a new one. So if you're thinking of changing, whether you're changing your existing EHR to a new one or going from manual to EDI, just let us know. So that's first and foremost, most important. Number two, if you're shopping or looking at different health record systems, maybe ask a little bit about the MOTS functionality. We do not dictate how the MOTS functionality works within a system. All we are concerned about is that the data is delivered to us in the right format with the right fields and the right information that meets our business rules. So maybe just ask, what's the actual business process? How does this functionality work within maybe the ones you're looking at, from like client entrance to submitting to MOTS? How much staff time might be required? Who will do each step? And again, there's no one way that's better than another. There's just differences in workflows. And sometimes that's just good to know, because you may have different roles or things that individuals will be taking on that maybe they weren't doing before, or you just change those around. So number three, project timing. That's important. Number one, letting us know that you're going to do something helps us to meet your project timelines. We have a process for switching data submissions. So since MOTS has been up since 2014, we've kind of learned lessons learned along the way, and I've worked a lot with the different providers in EHR. So we've got some good tips of what you should do and shouldn't as we're doing this process. The secure file transfer protocol, for those of you that are already submitting through EDI, your area that you send your files to and they get picked up will remain the same, even if you're going to a new system or an updated platform on your existing system. If you're getting a brand new EHR system and you haven't sent EDI to us before, then we go through a process to set up this for you. And it's basically a spot here at the state, kind of like, a post office, so to speak, where your electronic file comes to us and it comes in and we process it, and then we provide you another piece of information that lets you know how that file went and if you need to put any attention to some things that might need corrected. If you're going to a new system or updating from your paper process, we want to talk about your client IDs. We may need to change those from what you're currently using. We also will test your files through EDI. So if you're looking at systems and they're like, yeah, well, we have clients that send, our providers that send to EDI already to MOTS, and that's great. And they do. We still test the files at your organization's level, not at the at the system level that you purchase, because there's so much customization, which is wonderful, where you can set up yours to do different workflows and things, that we just want to make sure everything that's been put in and mapped and all the different values line up. We're going to go live once your testing's done, and then we're going to do some follow-up. The follow-up, it could be anything from weekly to bi-weekly to once a month, but organizations have found it helpful to just do a follow-up with our teams and sometimes their EHR, just to be like, okay, we're live now. How are things flowing? Do we have questions on what we're getting back for our information after we send a file? So, but we've really got a pretty well laid out process. Things work pretty smoothly. So again, just let us know and we're happy to get you on the docket of where you're going to be and help you make your project a success.
Excellent. Thank you, Jody.
Welcome.
And that brings us to Q&A. There we go, questions and answers. And we're timing it pretty well. Q&A, if you have any questions that you forgot or that pop up later, you can always send an email at any time to mots.support@dhsoha.state.or.us. We have several people monitoring, or at least one person per day, because sometimes people are sick or on vacation, but there's always somebody keeping an eye on it and trying to help you or pass on the questions to the right person. So again, the recording of this webinar will be on our MOTS website. And like I said, it usually takes a couple of days. On the MOTS website, there's also dates for future webinars. And those are always the first Wednesday of the month, unless it's some holiday, because I think we had the 4th of July once or something, or New Year's Day. So that's not going to work, of course. But usually the standard is the first Wednesday of a month from 9 a.m. to 10 p.m. So that's where, but you'll see them announced on their site. So, and here are all our emails of everybody participated. And I would like to thank everybody for helping out. At the bottom, you'll see the URL for the MOTS site, where you can get all the information and all the details and stuff like that. So any more questions before I bid everybody adieu? I saw a question pop up, and that was something about entering a client to find the record does not stay in the system.
I'm thinking this might be a somebody who's putting them in through the web portal, potentially. That would be helpful, I think, for us to know if it's a client entry, because a lot of times we get client entry for us to attend the EDI webinars, which is great to kind of know what's going on there. And so we get a lot of EDI providers that attend the client entry ones, because sometimes there's a lot that's cross-applicable. So we probably want to know, oh, so she says, yes, it's the client entry. So.
Correct. So why don't you send us an email, Sasha, so we can kind of take a look at what's happening, and then we kind of step you through. And one of the first questions is which browser? We only support Microsoft, Internet Explorer, Edge, and Mozilla Firefox. So those are the ones that we support. And usually, when you submit on the MOTS Client Entry Web Portal tool, there are some errors sometimes, and those need to be fixed before it actually submit the data. But if you're sure everything's fine and you just submit, it says it submits and it doesn't do it, then we should have to take a look at that. And we can set up a session and see if there's anything that we can help you with. Okay, and I think that was it. Excellent. Again, the recording will be on our website, and if there's no more questions, they might pop up later. Thank you all for joining, and I'd like to thank my coworkers for helping out today. And everybody, I wish them all a wonderful rest of your day. Take care. Bye-bye.